Right. Well, good afternoon, everyone, and welcome to the Iowa Cancer Consortium's Capacity Building Series webinar entitled Worksite Wellness, Preventing Chronic Disease. My name is Allie Bain, and I'm an outreach specialist at the Cancer Consortium. Formed in 2001, the ICC is a nonprofit member organization that works to improve disease prevention, early detection, research, survivorship, and quality of life for Iowans affected by cancer. More information about the ICC and its partners is available online at www.canceroiowa.org. This webinar is one of a series of webinars meant to increase knowledge among the ICC members and partners. We hope that you enjoy today's content and that you will check out our website, www.canceroiowa.org, for more information about archived and upcoming trainings as a part of this series. In response to February's Cancer Prevention Month and the year-round importance of ensuring that worksites across the state are helping employees to be healthy and productive, we are privileged to have two worksite wellness experts, Stephanie Neff from the Cedar Rapids Blue Zones and Katie Jones from Linn County Public Health here with us today. Before we get started, let's walk through some of the webinar features. The webinar will include computer listening only, so if you can't hear me, you need to turn up your computer speakers. If you are listening via phone, we ask that you mute your line using *#. On the right side of your screen, you'll see a chat box where you can interact with others on the call and ask questions to the presenters. Questions will be answered following the presentation. In the lower right corner is a handout for today's presentation. You can download to your computer by selecting the file and clicking Download File. If you are having technical difficulties at any time during the webinar, please indicate so via the chat tool and we'll work with you to resolve the issue. The webinar today will be recorded and made available at www.canceroiowa.org. While we gear up for our first presenter, please take a moment to type your name and organization into the chat box so we can see who all is joining us today. All right, our first presenter is Stephanie Neff. Stephanie Neff is the Community Program Manager with the Blue Zones Project, Cedar Rapids. She is responsible for overseeing community-level transformation in 6 sectors that help make healthier choices easier. Formerly, Stephanie served as the Deputy Health Director at Linn County Public Health and held the role of Project Director for the Communities Putting Prevention to Work and Community Transformation Grant Funding. She also served on the statewide Community Transformation Grant Steering Committee. Stephanie is a National Public Health Leadership Institute scholar and is currently spearheading a boundary-spanning leadership initiative in Linn County, Iowa through the Robert Wood Johnson Foundation Community Coalition Leadership Institute to address disparities in county health rankings. Our second presenter will be Katie Jones. Katie Jones is a health education specialist at Linn County Public Health. Through her position, Katie facilitates the Corridor Worksite Wellness Committee, which works to improve worksite wellness in Linn and Johnson counties. Katie is also the manager of Linn County's Community Transformation Grant. Katie was formerly a project coordinator at the Iowa Cancer Consortium and continues to be a proud member of the consortium. Katie has a Master of Public Health in Community and Behavioral Health from the University of Iowa College of Public Health. All right, Stephanie, the floor is yours.
Great. Can everyone hear me? I'm probably not going to be able to hear you, but yay, thanks, Rachel. Okay, so I'm very pleased to be here to tell you a little bit about the Blue Zones Project. I want to thank Allie and the Iowa Cancer Consortium for inviting me to give this presentation, and also thank my co-presenter, Katie Jones, for joining me to kind of round out some of the areas where she's a little bit more of an expert than I am. So I'm going to start by giving an overview of the Blue Zones Project. Some of you may be more familiar with it than others, but it kind of puts some context to the role of work sites in the prevention and management of chronic disease. So to start off, communities across Iowa are embarking on a well-being improvement transformation, and it's called the Blue Zones Project. It's brought to Iowa through an innovative sponsorship by Wellmark Blue Cross and Blue Shield in collaboration with Healthways. And the Blue Zones Project launched in 2000 in Iowa as the cornerstone piece to the governor's Healthiest State initiative. And it's part of Governor Branstad's plan to make Iowa the healthiest state in the nation by 2016, and that's based on the Gallup Healthways Wellbeing Index, for those of you who are familiar with that health monitoring tool. There are numerous supporters that you can see on your screen in a number of different fields. At the local level, we have specific individuals in support, but generally at the state level, public health, boards of health, elected officials are very supportive, schools, business leaders, restaurant owners, and grocery store managers, and I'll tell you why that's important in just a minute here. In 2012, Iowa communities began implementing the Blue Zones Project to create more livable, walkable, bikeable, and socially engaged communities. You can see on your screen that we have 10 Iowa communities with populations above 10,000 that are serving as demonstration sites for the Blue Zones Project, and then 6 additional communities with populations below 10,000 have also been selected. As a statewide initiative, we've made amazing progress, and I'll tell you about that in a minute, but I'm first going to start by telling you some parts of the world where people live longer lives, and then tell you about some of their secrets that author Dan Buettner found. And then I'm going to show you how our community has adopted it, and obviously my experience is specific to Cedar Rapids, but many of the other communities across the state have similar experiences as well. So to start from the beginning, the Danish twin studies established that only 20% of how long you live is dictated by your genes, and the other 80% is lifestyle and environment. So we found 5 places in the world where people actually live the longest. So these are real places where people live vibrant, active lives well into their twilight years, meaning into their 90s and possibly past 100 years old. The average American, as most of us know, suffers about 3 bad years at the end of their lives. During those 3 years, we spend 95% of our lifelong healthcare dollars. In Blue Zones areas, as seen on the map in front of you, people tend to stay sharp and active to the very end, and they can spend 1/5 of what we do on healthcare costs. So author Dan Buettner, for some of you who may have read his book, was funded by National Geographic and he went and visited these places and looked at these longevity hotspots where people tend to live up to 12 more good years than United States citizens. So his research led to an article in National Geographic titled The Secrets of Living Longer, and then he wrote a book, The Blue Zones, 9 Lessons for Living Longer, and that's the premise of the Blue Zones Project. Dan also went on to write a book called Thrive, and is working on his 3rd book right now, which actually includes some examples from the Blue Zones Project and stories of people in Iowa who have been influenced and changed their health behaviors as a result of the project. Not sure when that is going to be released. So Dan's research has confirmed that there are actually 9 lifestyle principles known as the Blue Zones Power 9 that are common to the Blue Zones areas where people live longer, happier, and healthier lives. The Power 9 are lifestyle principles, which are small, easy steps that everyone can take in their daily lives to feel better, live longer, and be happier. And here they are. These are probably no surprise looking at the participants today to most of us, but they're things that include moving naturally. So not necessarily having to go to the gym every day, but making daily physical activity an unavoidable part of the environment. And I know the Cancer Consortium and many others promote things like parking further away from the store, walking to certain locations instead of driving, et cetera, et cetera. The second tenet is having the right outlook. people who know their purpose tend to live on average 7 years longer than most Americans. And then also downshifting, being able to work less, slow down, take vacations, basically having mindfulness about stress and how it impacts your body. The third level is eating wisely, obviously a clear link with chronic disease prevention, management, and specifically cancer. In the Blue Zones communities, Dan found that for the most part, people who lived those long, healthy lives tended to eat until they were 80% full, so eating slowly and, again, mindfully to give your body that 20 minutes that it takes for your stomach to trigger your brain that it's actually full. Eating more veggies and less meat and processed foods, and actually drinking a glass of red wine each day. Red wine tends to be high in antioxidants. Obviously, one of the Power 9 principles is for adults over the age of 21 who have a healthy relationship with alcohol, not promoting anything illegal here. And then foundationally to the Blue Zones Project, and if you've ever heard Dan Buettner, I had the opportunity to hear Dan Buettner speak, he really talked about social connectedness being a huge part of our well-being. Creating a healthy social network. Through his research, he found that people who are connected with religion, meaning they regularly attend some kind of religious or spiritual services, tend to live between 4 and 14 years of healthy life longer than the average U.S. citizen. And then prioritizing family. So typically we know that if we want to be able to live healthier lifestyles and implement the Power 9 principles, we need an environment that supports that. And that's where worksites come into play. We know that typically, the quick fixes are not the best way to reduce and prevent chronic disease. So then how do we get communities to adopt practices aligned with the Power 9 principles? And what research has found is that the only places in the world that have sustainably gotten their population healthier did so by making long-term changes to the environment. So most Americans spend 80% of their lives within 20 miles of their home. So the Blue Zones Project focuses on 5 big levers that impact people within that 20-mile radius of where they live. The first one is policy. So are there policies in place in a community that favors, where taxes and subsidies favor vegetables, or do they favor unhealthier foods like chips, sodas, those types of things? One of the huge policy support mechanisms that we have in Iowa that we do not have in most other, in a lot of other states that the Consortium was very involved in was the Smoke-Free Air Act, and that, somewhat unique to Iowa as a state, but a huge policy that has really changed the environment to promote healthier behaviors being easier. The next lever is built environment. So living in a community also where there are places to visit, to actively transport to move naturally to. According to the Robert Wood Johnson Foundation, even if communities just clean up their parks, create bike lanes, and make streets walkable, they can increase the activity level of the city by up to 30%, which is pretty significant when you look at the importance of moving naturally and just getting people out and getting them active in their daily environment. The next one, as I mentioned earlier, is creating those social networks and helping people forge relationships with others who want to change their health habits. And you can see how some of these are starting to, even though they're overarching strategies that are relevant to the community, you can see how they're starting to connect to sort of that smaller community of worksites. So how are we, creating a built environment around worksites that helps facilitate some of those changes? How are we utilizing worksites and connecting employees together to form social networks and forging relationships with people that encourage them and support them in creating healthier habits? And there's a huge opportunity there with our worksites to do that. Next are the building designs that also impact our health habits. and this applies to schools, stores, and obviously work sites. So there are over 70 design features that can help workplaces be healthier. Katie's going to give some specific examples of some of those, but just they don't necessarily have to be structural changes, but just changing some things within the buildings can make people not even realize that they're eating less or moving more. Things like using 10-inch plates in a cafeteria is one example instead of 12-inch plates. We consume, on average, 22% more calories with the larger size plates, and most people wouldn't even know if a workplace cafeteria or a restaurant, for that matter, were to do something like that. And then lastly, oh, I'm sorry. I missed the slide in my presentation, but the last of the 5 levers is actually helping people find their purpose and really instilling that inherent driven motivation to be their best and be contributing to society. And obviously workplaces have a huge role in that as well. With the Blue Zones Project, we actually offer up the opportunity to sponsor a purpose workshop where work sites would be able to bring in a trained purpose workshop facilitator and hold a purpose workshop for their employees to help their employees kind of identify the skills and the talents that they're most passionate about and align them with their job responsibilities so that they feel that greater sense of purpose. And again, that reduces stress and helps facilitate healthier behaviors. So there's no silver bullet for improving well-being, but there may very well be silver buckshot. So that's what the premise of the Blue Zones Project is that through a coordinated strategy that reaches across age groups, interests, income levels, and industry sectors, an environmental approach seeks to create permanent policy change that makes healthy choices easier. Just to give you a little bit of information about the demonstration sites and what the demonstration sites are working to achieve to be certified as a Blue Zones community. The certification process means that communities have gotten to a certain level where their surroundings have been optimized to improve well-being in these 6 sectors that you see in front of you. So when each sector has done its part, then the town is certified or the city is certified as a Blue Zones community because all of the critical environments have been transformed to make healthy choices easier. So you can see that work sites for employers is on that list. In Blue Zones demonstration sites, 50% of the top 20 employers need to be designated as a Blue Zones work site. In Cedar Rapids, larger communities, obviously it's going to take a little bit more than 10 work sites to get that threshold of engagement that we're looking for. So we are actually shooting for 20 out of our top 20 employers being designated, but in many other communities that are a little bit smaller, that have fewer work sites to begin with, then getting 10 of them kind of designated, working through a checklist of ways that they are changing their internal environment and doing some of the things Katie's going to mention. It is a pretty significant movement towards supporting the prevention and management of chronic disease. The Blue Zones Project originally was implemented in 3 communities in California, in the beach cities. And so because the project is so new, the research definitely supports the actions that are moving forward. But in terms of the data, long-term data, there is no long-term data available. The beach city communities have data from 2010 to 2012. And what they experienced was a 3-point boost in their in the Gallup Healthways Wellbeing Index, which is significant because it's such a stable index, and a 3-point jump in 2 years is a considerable movement. And one of the things that contributed to that out in California was that they actually banned smoking on all of their beaches, and so they had a significant reduction in tobacco use. And this 3-point boost actually resulted in a $9.32 million savings in healthcare costs, and that's just emergency room visits not including productivity, employee productivity, those types of things. So pretty significant from a cost saving standpoint as well. And again, that's the result of a 14% drop in obesity, a 30% drop in smoking, 10% boost in exercise, and 9% boost in healthy eating. And you can see the numbers there on your screen. So in Iowa, again, the governor's goal is to be the healthiest state in the nation by 2016. In 2011, when the project kind of got ramped up in Iowa, we were 16th in overall well-being. And in 2012, we made a huge jump to 9th overall in well-being. And part of that was that the work environment index component of the well-being index increased significantly from 23rd, being ranked 23rd, to being ranked 4th. In addition, Iowans are reporting that there is a bigger lift in the feeling that their community is getting better as a place to live, and they're reporting that they eat more fruits and vegetables, so 5 or more servings of fruits and vegetables 4 or more times a week. So there is significant progress being made overall, and all of these things are contributing to this boost in the Gallup Health-Wise Wellbeing Index, and ultimately then that healthcare cost savings that has been experienced in California. And so Katie's going to give you a few examples of some of the specific things that worksites have done or can do to help contribute to the overall well-being environment in the community.
Looks like the presentation is getting uploaded now. Thanks, Stephanie. And I just want to thank the Cancer Consortium again, too, for having me speak today. And then, oh, starting at the back. And thanks, Stephanie, too, to bringing me, oh, yeah, this is towards the end. I'll just, don't look. Okay. So like Stephanie said, I'm going to talk a bit about some specific strategies that I tried to pick ones that are fairly easy and inexpensive to implement. So first, though, I'm going to talk a little bit building off of what Stephanie said about why worksite wellness. A lot of people on the call know this, but basically worksites are a great opportunity to target wellness and improve employee health. According to Healthy People 2020, people spend about half their waking hours at work. So, and they spend a lot of years at work too. So it's a great opportunity to get people where they're at. Worksite wellness can help prevent chronic diseases, including cancer, since there is a link, especially with physical activity, nutrition, and tobacco use to chronic diseases and cancer. Also, the American Cancer Society, the CDC, and many other organizations support doing environmental and policy changes at worksites to help reduce the development of chronic diseases. A lot of people may think worksite wellness has to be expensive or it's difficult, but really there's a range of different things worksites can do, and some of it is very inexpensive and easy to implement. So I'm going to talk about strategies for increasing physical activity, increasing healthy nutrition, decreasing smoking and tobacco use, and then also supporting new mothers. All right, so first, move naturally. That's the Blue Zone's term for also just increasing physical activity, but move naturally sounds a little more fun than physical activity. These pictures just show 3 different ideas. This one represents a point of decision prompt. I'm trying out this neat draw tool right now. Let's see. Oops. So this is a point of decision prompt. I don't know if you guys can see my cursor. That might just be easier to just. This is from the city of New York. Basically, the health department created this. And one thing that's neat about this is it's extremely inexpensive. It's just the cost of printing something. And it's evidence-based. There have been studies that show if you put these near elevators, people do use the stairs more. It's actually an evidence-based intervention. It's something the Community Guide, if you're familiar with that resource, recommends with strong evidence of effectiveness in increasing the percentage of people choosing to take the stairs rather than the elevator or escalator. So that's a great thing worksites can do. It's really easy. Another easy thing is just set up walking groups. This is something the Blue Zones does a lot with their walking moais. Moai is basically a word for a close group of people, and they have walking moais where people get together and walk regularly. If your worksite allows people to walk during their 15-minute breaks, you could potentially be walking half an hour a day. So this is actually Linn County Public Health employees taking a walk. I think for the Start Somewhere walk for Blue Zones. And then also having bike racks, encouraging active transportation to work. Bike racks range in cost, but that's another great way to show that you support people, biking and walking to work. And also if you have customers, that you are providing for them if they use some other form of transportation. I also just wanted to say the community guide recommends just generally doing environmental and policy approaches to increase physical activity, especially the creation of enhanced access to places for physical activity and outreach activities. Other things worksites can do, adopting a policy stating that you support employee physical activity is a great way to show that as an employer you support your employees being active. You can spell out what that means in the policy too. And also providing more opportunities to be physically active at work, having a room with some free weights, and maybe a small TV to watch exercise videos, on-site facilities for exercise. That's another great way to support moving naturally, being physically active. So I just have a few resources here. This is the CDC's basically point of decision prompts that they came up with. This might be a little easier to print than the green one the city of New York had. But there's just called Stairwell to Better Health. Again, really simple. This is what the city of Cedar Rapids uses. Also, the CDC has a worksite walking campaign tools, and then of course the Blue Zones has resources as well, and there's a lot of other things online. Really good for moving naturally. All right, and those are on the handout, I should say too. So if you download the handout, these are on there. All right, so next is Plant Slant, or healthy nutrition, and so these are just two really simple ideas. And again, the community guide talks about improving, that the worksite is a great way to improve access to healthy foods. So this picture basically represents if you have a meeting or a cafeteria or you host an event, make sure the food there is healthy. At least if there's a healthy option, or just make all the food healthy. People tend to eat whatever's available, whatever's there, and this is a great way for you to provide healthy options and introduce people to food they might not have tried before. People are a lot more likely to buy a healthy food if they've already eaten it once. They're not as likely to buy it if they haven't had it before. This is something Blue Zones is really good about here. At the meetings that we have, they have healthy food, and they also give an explanation of what the food is. They have the chef come in and explain what it is so that people know, oh, so that was quinoa, and then they might go home and try it, and it's been really delicious. Also, giving locally produced foods is another great way to support the local economy. So it's just an example. And another example, relatedly, is if you have vending machines, label healthy options, and you could adopt a policy saying that a certain percentage are going to be healthy options. One great resource for healthy options is NEMZ. I have a link back there. And this is something that ICC actually funded a mini grant project to incorporate more NEMZ vending standards. Basically, NEMZ is a way to categorize beverages and snacks as either red, which is unhealthy, yellow, which is kind of in between, and green is a healthy choice. It's a traffic light system. And you guys may have seen recently there was an infographic that was making the rounds. I know the ICC posted it on Facebook about a hospital that did the traffic light system, and they found that it did increase healthy choices being purchased. And this is actually from Fairfield Parks and Rec using the NEMZ system. You can see, I like this picture because it shows G2 Gatorade as a red unhealthy option. I think a lot of people assume, oh, Gatorade is sporty, it's good, but actually according to the NEMZ criteria, it's not. And it is a sugar-sweetened beverage. So you can see here, really easy to identify it. It makes it, people know what's the healthy choice. So that's another great way. And again, having a policy to back this up is also wonderful and a good way. In case leadership changes, you have it in writing that you're going to provide healthy choices, or have maybe 50% of options in the snack machine healthy. You can also implement a pricing strategy to make the healthier foods less expensive and the unhealthy foods more expensive to offset the cost. That's something the city of Cedar Rapids has implemented, and it's something that if you talk with the contractor for the vending, they might be interested in because it helps basically encourage people to eat the healthier options. I think Grinnell Regional Medical Center did something similar in their cafeteria as well. They have a healthy meal that's cheaper than the other meals. All right, so these are some resources. The American Cancer Society has a wonderful tool called Meeting Well. It's for planning healthy meetings and events. It actually also incorporates some physical activity tips too, but it really has some great snack ideas and food ideas, and talks about that. This is more information about NEMSB, and so that's a great resource too. They have their calculator. Their criteria is a little complicated to explain because it's very rigorous, but at least the labeling is very easy for lay people to understand. And then also the Eat Well, Work Well, this site just has some sample policies. A lot of times people like the idea of a policy, they don't know where to start, so this has some sample policies. All right. And again, those are on the handout. So another big key area, especially for cancer prevention, is reducing smoking and tobacco. And like Stephanie said, we have the Smoke-Free Air Act, which does cover almost all work sites. It also covers cars owned and leased by employers, which is something I think some work sites don't know. And that act requires signs to be posted. So if your work site doesn't have smoke-free signs posted at the entrances, you should contact your local public health department to try and get some, or IDPH. But aside from that, even though we have the Smoke-Free Air Act, and that's great, you can go above and beyond that as a work site. You can become a tobacco-free campus, and so that's a great way to reduce tobacco use. Here's a sign that Linn County Public Health produced for one of the work sites here that went tobacco-free. Another great tool, and this is, both of these are no cost to the employer really, becoming tobacco-free, and then also promoting Quitline to employees is another great low-cost way to help reduce smoking and tobacco. The community guide recommends smoke-free policies and also talks about some other ways that are good to help reduce tobacco and smoking. In employees, they talk about tobacco cessation groups, client educational materials or activities, telephone-based cessation support, counseling and assistance from healthcare providers, and access to effective pharmacologic therapies. Obviously, those range in cost, and it kind of depends on your work site. But also, if you offer insurance to your employees, to let them know about the benefits that are already in the insurance for tobacco cessation is another great way to improve that. And just, a lot of work sites will promote physical activity and nutrition, but they'll forget or won't do as much with reducing smoking or tobacco cessation, and that's another great thing that a worksite can promote. For resources, this is a really great one from the American Lung Association. It's actually created by Iowa staff of the American Lung Association with IDPH and some other partners locally in Iowa. It's a toolkit for making your worksite tobacco-free. It has sample policies and kind of some steps of how to go through that process. And also, this is just the website for Quitline, Iowa. Again, a great resource. I'm using the handout. All right, so lastly, I'm going to talk a little bit about supporting new mothers, and you might think, well, why? What connection does that have to cancer? But so the American Academy of Pediatrics recommends that mothers breastfeed babies exclusively for at least 6 months, and then followed by breastfeeding in combination with the introduction of complementary foods until at least 12 months of age. And the connection to cancers, that some cancers are connected to obesity, and according to the American Academy of Pediatrics, there's a 15 to 30% reduction in adolescent and adult obesity in breastfed versus non-breastfed infants. Again, that's 15 to 30% reduction. So this is really talking about future generation of workers. So that's why it's in here. It's important. Also, I wanted to pass along, I think a lot of work sites I've talked to aren't aware that there are new federal standards for work sites. Through the Affordable Care Act, there was a change to the Fair Labor Standards Act, So now this is a quote, employers are required to provide reasonable break time for an employee to express breast milk for her nursing child for a year after the child's birth, each time the employee has the need. And then employers are also required to provide a place other than a bathroom that's shielded from view and free from intrusion from coworkers in the public. So basically a lactation room. So, and if you're an employer that has less than 50 employees, you're actually still subjected to these laws unless compliance would impose an undue hardship. So this really does apply to all work sites for the most part. So that's something, if your work site doesn't have a lactation room, that's something to consider getting set up. And it can be a room that's used for something else some of the time, but as long as it's labeled and is there and it is a private space that isn't a bathroom. And then also just making sure that new mothers know that they can take that break time. This is something that's really great for a worksite to have their own policy that supports new moms. It lets the employees know that that's something that the worksite cares about and supports. So again, that's something the worksite can do. And again, the policy doesn't really cost money to implement or to put into place. So these are some resources. This has more information about the new laws from the U.S. Department of Labor. It's a really easy to understand website. And then in terms of the sample policy, this is one from the California Department of Public Health, just as a starting place if you want to draft your own policies. Those are in the handout. And then finally, these are just some general resources that I wanted to share. The first one is from the Iowans Fit for Life Healthy Worksites Toolkit. This was paid for by the Iowa Cancer Consortium and IDPH, and it's really a wonderful toolkit. I recommend it all the time, especially to worksites that are getting started. It talks about how to form a worksite wellness subcommittee, and also going on from there, how to implement a wellness program and really affect wellness in multiple ways. So that's a great resource. And then also, the CDC has a National Healthy Worksite Program. This is something they're actually implementing in some states, but aside from that, it looks like Iowa was not one of them, but they have a bunch of resources on their website too that are a great tool for you if you're looking for more resources. And those are also on the handouts. All right, so any questions for me or for Stephanie? Or
actually,
there's another slide,
yeah, maybe we can, we'll come back to questions. I just wanted to share one kind of success story. So Katie gave a lot of examples about promoting moving naturally and Slant, having space and time for mothers to breastfeed. And if you're familiar with the Blue Zones Project, then you know that the Blue Zones Project is based on creating kind of a checklist or a menu of options from all the research-based practices. And then in order to get a worksite designated as a Blue Zones worksite, they have to kind of demonstrate that they've achieved or they've implemented a certain number of those evidence-based or research-based practices into their worksite. And all of the things that Katie mentioned are examples of what they could choose to do. But I wanted to circle back and say that all of the things that happen in the worksite too, and this is what's kind of unique about the Blue Zones Project, is that they can be either, barriers can be created, or the environment can support the things that are being implemented in the work site. So even though people spend most of their time in, a large majority of their time in the workplace often, the same thing with children in school, if we just make changes within work sites and within schools, we're still only going to have a limited impact. So the success story, we have many from Cedar Rapids specifically, but I just chose the city of Cedar Rapids because they had a number of different examples. And what they're really working towards is engaging their employees, because engaged employees are healthy employees. And recent research has demonstrated that 66%, if you reach 66% of your employees, then you tend to have a higher functioning organization. So you're more efficient organizations, higher productivity organizations tend to have at least 66% engaged in their workplace wellness program. And that doesn't just mean participation rates in biometric screenings, although that is one component. It really means, how is the culture of well-being being created within that organization, and how is that then spreading outside of the organization? So, for example, you can see in my bulleted list here with the Cedar Rapids Wellbeing Engagement Strategies, they have the tobacco-free campus. They have a wellness committee with champions from all departments that gets together monthly. They have breastfeeding space and time, and they have bike racks, like Katie mentioned. But some of the things that they're doing that are a little bit more unique is that they actually have a disincentive for non-participation in biometric screening, which resulted in a doubling of their participation rates for the biometric screening. So essentially, the disincentive is that if you don't participate in the biometric screening, your healthcare costs are going to go up. And so, again, it doubled their participation rates. Still not quite at 66% where they would like them to be, but definitely much closer than they were last year. The city, as Katie mentioned, does a cost differential for vending, so they label their healthy foods using the NEMSB, but they also have healthier options are 10 cents less than what they normally would be. So they would be 90 cents, for example, 90 cents for a bag of peanuts, and $1.10 for a Snickers candy bar. So they've done that, and that is working well for them as well. They have an on-site gym with a $5 membership for the employee and their partner to promote kind of having a buddy to work out with, which is one of the Blue Zone's recommendations. And then they actually have on-site bikes available to promote active transportation between meetings so that employees don't have to always drive. They have a couple of different sites. So this is obviously for larger employers if they're just going back and forth between their own sites, but also for employers that their employees are out in the community doing things frequently, and they have those bikes available, and the employees just check them out, and they can, leave City Hall and go over to the City Services building using active transportation. The way that policy comes into play is that they also need to, they provide that for their employees, but if there's not bike lanes and safe bike routes from City Hall to the City Services building, then they're not really doing anyone a favor by offering those bikes. So the city has the ability to also have significant influence over the policies that are implemented, but worksites have a role in advocacy where they really need to if they're going to start an active transportation program, they're doing things within the building, adding bike racks, making showers available to promote active transportation. They really also need to be advocating for good, safe, active transportation systems within the community. So it feeds back to that built environment. One of the other things, I forgot to mention too, with the vending machines, they don't have a cafeteria on site. So they have the healthy options with their vending machines, but then the way that they link up with the Blue Zones Project restaurant sector is that employees either typically bring their lunch or they go out for lunch. So if they want to facilitate a healthy workplace and really encourage healthier choices, it's in their best interest to reach out to restaurants that are located around their work site where their employees go to eat and ask the restaurants to look at how they're promoting healthier options or making healthier options easier as well, so that they know that their employees, as much as they're facilitating healthy choices being easier in the workplace, they're also being supported by the community when their employees go out on their lunch break to eat. And they have done that as well. Our city manager wrote a letter to all of the restaurants, all the restaurant owners and managers within a certain distance of their facilities, and asked them to please consider working with the Blue Zones Project to implement research-based practices that promote healthier eating. The Vitality Compass Challenge is also an example of one of the things that has increased engagement more from a social connectedness standpoint. The Vitality Compass is a Blue Zones project tool where people go online and they can find out their biological age versus their well-being age, essentially. So depending on your health behaviors, your body could be functioning at a younger age than you actually are. And it's just a fun tool. It gives the top 3 opportunities for improvement, stress reduction or healthier eating or physical activity, but it gets people talking in the workplace. And again, this is totally free. It gets people talking in the workplace about well-being and about, oh, well, I need to eat healthier. And people start forming connections around, oh, you had healthy eating and I had healthy eating. They both came up on our Vitality Compass. Yeah, maybe we should get together and encourage each other to, bring healthier lunches, or when we go out to restaurants, we need to make sure that we're kind of monitoring what each other is, eating. And so they created a challenge and are kind of saying, well, how young is your body? How young is your body? But it facilitated that conversation. And then we've also implemented, like Katie talked about with the walking, the moving naturally, and the walking moais. And moai is a Japanese word that basically means a small group of people meeting together for a common purpose. They implemented a cross-department socialization around healthy behavior and in the form of potluck moais. So some of the feedback that they got from listening posts that were held by the city manager and the assistant city manager was that they really, they wanted a sense of connectedness. That was where the employees got the most energized. That's the type of work that they enjoyed the most, was when they were connected across departments. They weren't kind of working in their own cubicle all the time. And so they wanted to help facilitate those connections, those social connections within the workplace. It's also a retention strategy for workplaces in addition to promoting healthier behaviors, because if people feel connected to people at work, they're less likely to leave the workplace if they have social connections there. And so they kind of put out an email and said, if anyone is interested in, healthy eating over their lunchtime, let us know. They had about 30 people interested in participating and divided them in groups based on when, they took their lunch and how long their lunch was and what building they were in. And those groups of 5 to 9 people are going to get together and learn a little bit about each other, socialize, share healthy recipes, eat healthy foods over lunchtime for the next 10 weeks, which is the program. But what we're finding is a lot of these moais go on beyond that because people do form those social connections. And so in Albert Lea, Minnesota, which was the pilot site for the Blue Zones project, 60% of their moais that they formed during their time as a Blue Zones demonstration site are still active, just because people really connected around something and were craving that social support, and they really felt like it influenced their well-being in a positive way. So, that, again, like I said, that's just one example of one employer who's really trying out some unique strategies for engaging their employees in worksite wellness, not just doing things to employees, not just changing the environment. The other thing that they found was, for example, they were doing their ergonomic checklist for the Blue Zones project, and they said, oh yeah, we have the policy, and Katie has emphasized the importance of having policies so when leadership turns over, that remains consistent. But also on the flip side of that, it's great to have the policy, but if no one knows that it's there, it's not very valuable. So what the City of Cedar Rapids found is that they had this ergonomic checklist, but nobody knew how to implement it. It wasn't communicated very well. And so they've made some changes to help inform employees of the availability of those tools to improve their well-being. And so they're really on the road to creating that culture of well-being, and it takes all of those pieces working together, but it may not cost, a lot of money, and yield some great results in terms of return on investment with healthcare cost savings, particularly for self-insured employers, and the city is a self-insured employer and obviously funded by tax dollars. So it's in the best interest of all of us for the city to be implementing strategies that decrease their healthcare costs.
It looks like Rachel had a question. Up here.
So Rachel asked, if an organization or individual wants to get involved in Blue Zones projects within their community, how would you suggest finding contact information for staff in your area? Great question. So like I mentioned at the beginning of the presentation, there are only certain communities in Iowa that are demonstration sites, and those communities have full-time staff that are leading the Blue Zones project. If you go to www.bluezonesproject.com, you can find if your community is a demonstration site that has full-time staff, and you can contact us directly through the website. If you're not in a community that is a demonstration site but are more interested, have interest in the Blue Zones project, typically, I'll speak for Cedar Rapids, but typically if you have a community close to you that is working on the Blue Zones project, they can kind of help and share some information, but there are some tools available even if you're not a demonstration site. And there's also a state team that is working with some of the communities that are not demonstration sites, not to implement the full project, but to at least give a sense of what are some things that you can move forward with, and there's some resources available on the website as well.
Are there any other questions?
So if you guys do have questions, you can feel free to type them into the chat box, and Katie and Stephanie will answer them. I just want to take a second to thank Katie and Stephanie for presenting today. You guys did a fabulous job, and we appreciate your vast knowledge of this topic. I also wanted to let the participants know that you will receive a survey at the conclusion of this webinar. It will open automatically in your browser, so you should be able to see it when you close the webinar.
Great, thanks, Allie.
Looks like we have a couple people typing.
Oh, most difficult worksite. So Rachel asked, you guys I'll see this, most difficult worksite wellness initiative that you've implemented, and how have you overcome those barriers? Well, I think with the worksite wellness initiative, just generally speaking, it just sort of depends on the buy-in. There can be something that's really complicated, but as long as there's buy-in, especially it helps if leadership bought into it, then it can go really smoothly. For example, and then vice versa, there can be something that's kind of simple, but if there isn't a buy-in, it relates to what Stephanie was talking about engaged, having people engaged in wanting something too. So sometimes you have to backtrack and kind of build that request for something. I know I worked with the NEMZ mini grant, and we put in a lot of work to that, and then we went to do the vending post-assessment, and sometimes it's like, oh, there was a miscommunication here, and then just going back and be like, these aren't healthy choices actually, so, and NEMZ can be pretty simple, especially if it's something that the team really wants and is communicating that with the vendor. I can't really think of one particularly extremely difficult worksite wellness initiative. If you have a solid worksite wellness team and engaged employees and leadership buy-in, things can go pretty smoothly, and you can be creative even with a limited budget, is what I'd say. So, all right, how is progress being evaluated and measured within the Blue Zone project? I'll let you talk about that. Thanks, Rachel.
So a couple of ways that progress is being evaluated and measured within the Blue Zones project. One is obviously that the goal of the demonstration sites is to become certified as a Blue Zones community, so make enough changes in each of those 6 sectors that there's an impact on population health. And so using all research-based strategies or evidence-based strategies, the intent is to get to kind of that tipping point within a population where there's a cultural shift towards well-being. So that's one of our process measures, is how many restaurants have been designated, how many grocery stores have been designated, how many schools, work sites, et cetera, how many community policy changes have been implemented. The other way it's being evaluated is on the Gallup Healthways Wellbeing Index. So the specific strategies that we're implementing tie in with the questions that are asked of the Gallup Healthways Wellbeing Index. Demonstration site communities are being oversampled for that index to ensure that we have valid and reliable data. And like I said, that it takes a little longer with the well-being index to possibly see those results. And then the third way that we're tracking and evaluating our progress is by identifying additional impact indicators. And for each community, that looks a little bit different depending on the size of the community and the data that's available. But looking in each of the 6 sectors to see what has changed. So, for example, in grocery stores, one of the grocery store criteria is to create a Blue Zones Project checkout lane where there's only, instead of the candy bars and chips, there's only healthy options in that checkout lane, and then highlighting specific Blue Zones Project foods or foods from the Blue Zones food list, fresh fruits and vegetables, and then tracking sales of those products versus sales of other products. And so I know that it's been about a week ago that one of our grocery stores, one of our Hy-Vees, implemented a Blue Zones checkout lane, and they're watching to see, in the first few days, I think it was, that they actually sold 9 individual pieces of fresh fruit out of their Blue Zones Project checkout lane. Just in the first week it was up, and that's just one checkout lane. So sales increases would be an example for grocery stores. Healthcare, employee healthcare costs would be an example for Worksite. Restaurants, again, are based mainly on food sales. And schools are a little bit more difficult to track, but it's, because it's more based on the learning objectives, how focused are our kids, what are the test scores look like. So yeah, there's a number of different ways that we're evaluating both process and outcomes, and then down the road, hopefully seeing an impact, circling back with that well-being index to see if that change was sustained in the community.
I just wanted to add to, sorry, Allie, can I just add one thing really quick? I know we're almost out of time.
Yep, go for it.
In terms of difficulty, I think one thing, and this kind of relates to what Blue Zones is about, but also what public health is kind of a shift, and I know the Community Transformation Grant is about this too. I think one thing, a lot of people who have been involved with worksite wellness, there tends to be sort of this emphasis on education, which is still really important, but encouraging employees to eat more fruits and vegetables just by saying what the benefits of that are. And I think one thing that's kind of slowly happening in the worksite wellness world is this emphasis on policy and environmental changes. And so I think that sometimes when you're working with people who maybe don't think in that way and they're really focused on, one-time events or, brochures and things like that, which still are important, especially for engaging employees and getting people involved. But just keep touting that message of policy and environmental changes are really important too, and that's going to be long-term, evidence-based changes to improve health. So I think just if all of you can be champions for policy and environmental change, that'll help change that mindset to thinking in a more systems-level way.
And then tracking the actions that people are taking as a result of those healthier choices being easier in the workplace, and then monitoring the healthcare costs down the road, and that's really where the investment comes in.
All right, do we have any more questions? Okay, well, again, I just want to thank Stephanie and Katie for presenting today, and I also want to thank all of the participants. We hope that you found this information valuable. Please contact us if you have any questions or need any additional resources, and also please remember to fill out your evaluations. So thank you very much, everyone. As I mentioned before, this webinar will be is recorded and will be archived on Cancer Iowa at the conclusion. So we hope that you all enjoyed it and enjoy the rest of your day.
Thank you all.
Thanks, everyone.